Well, finally, the United States of America is doing something to control the price of drugs, if only for senior citizens. But it's a start. And it will only happen if the health insurance companies and the drug companies don't have their way. So come and see what's at stake. Join me on another edition of Timmy Talks. Yesterday, in a press conference held by President Biden and Vice President Harris, it was announced that the Inflation Reduction Act will be started to be enacted.
So we are here today with the firm belief that in the United States of America, no senior should ever have to choose between whether they are able to fill a prescription or fill their refrigerator with food. We know for years, far too many of our seniors, millions of our seniors across the country have struggled to afford their prescriptions. And too many of our seniors risked their health as they may have delayed to refill their prescription, or they cut their pills in half to try and stretch out the length of time that they could take their medication. So since we took office, President Biden and I and our administration has taken historic action to cut the cost of prescription medication for our seniors. We capped the cost of insulin at $35 a month. We will cap the total cost of prescription drugs at $2,000 a year. And we have made vaccines free of charge, which will save seniors hundreds of dollars every year. And we finally allowed Medicare to negotiate the price of medications with big pharma companies.
In case you're not familiar with the Inflation Reduction Act, let's go over what the provisions are. Now, this law was actually passed in August of 2022, but will be effective in 2026. And I personally think it's because it's going to allow all of these companies who are suing the government over this to have gone through the court system and be free and clear to do what they need to do. It really includes permission for Medicare to negotiate drug prices for the 57 million Americans today who are on Medicare. And it's estimated to save about $98.5 billion over the course of the next 10 years. The provision makes a cap of $2,000 a year per senior to spend on medication. So after $2,000 is spent, all the medication is going to be free. And insulin for diabetes is capped at $35 a month, regardless of how much insulin is needed. Currently, U.S. citizens are paying approximately 256% higher for their drugs purchased here in the U.S. than the same drug by the same manufacturer in other countries around the world. And I know in 2020, President Trump had signed an executive order to allow cheaper Canadian drugs to be sold in the United States. How crazy is that? So this is building upon that and now allowing really cheap drugs to be sold to our seniors who are on Medicare. And something interesting to note, from 2003, the Washington Post reported that 10 million Americans at that time were bringing in medications from their foreign trips. And there were about 2 million packages of medications coming in from Thailand and India. Now we're at 20 years since that survey was taken, and the prices of drugs are astronomical. Can you imagine what comes in now? So let's take an in-depth look at exactly what medications are going to be covered and when they're going to be covered, etc. Here's a closer look. The information I was receiving about the Medicare rollout for drugs was a little bit all over the place. So I was able to put the following together. In 2026, 10 drugs have been selected to keep the American public healthy. And these drugs will have reduced pricing per the negotiations that they will be doing. In 2027, they will be selecting 15 more drugs. They haven't been selected yet, but they will be adding 15 more to this list. Then in 2028, there's going to be 15 more. And then in 2029, there will be 20 drugs more. And every year thereafter, there will be 20 drugs added to this list. So only 10 to start in 2026, but then there will be 15 more and 15 more and 20 more and 20 more and 20 more to cover all of the important drugs that all of our seniors need in the United States. Now, here is a complete list of the first 10 drugs that are identified as being reduced cost for seniors. They include Eliquis, which is a blood thinner, Jardiance for diabetes, Xarelto, a blood thinner, Januvia for diabetes, Farxiga for diabetes, Entresto, heart failure, Enbrel for autoimmune disease, Imbruvica for cancer, Stelara for Crohn's, and Fiasp Novolog for diabetes. I think this is really great news for our seniors. Of course, it hasn't trickled down or won't trickle down to the average everyday citizen of the United States, but at least it's a start to save some money as you get older. But, the problem is going to be the insurance companies and the pharmaceutical companies. I think that this is not going to be enacted until 2026 to allow these companies to come up with their lawsuits and get through the court system. So then everything is clear to go, in 2026. So let's take a look at these pharmaceutical and healthcare companies. How much money have they made? Well, on our list here, United Healthcare tops the 2022 net profits at $20.6 billion in net profit after they've paid out all of their expenses. Second on the list is Humana with $17.2 billion, Cigna with $6.7 billion, and CVS Health, which also owns Aetna, is $4.1 billion. Look at how much these companies are making every year. I do have to share a story. I worked for one of these companies for many, many years. And when we were a subsidiary, I was trying to get paper and pens for my staff and just trying to get things that were needed for everyday use. And one of the executive vice presidents told me personally that we have to limit our spending because this is all on sick people's dime. It's sick people's money. Wow, really? This is sick people's money? I think this is everyone's money. I think we're being robbed blind by these insurance companies so they can make a profit. I can't believe that she said that to me. I still remember to this day that, Sharon, yes, you were wrong. This is not sick people's money. This is stealing people's money. And the pharmaceutical companies are no better. Look at these profits. Pfizer with $31.4 billion. Johnson & Johnson, 17.9, Merck, 14.5, and on and on. The billions and billions of dollars these companies are taking in year after year. And you have to remember that 2022 financial year was pretty poor. It was the end of COVID and coming out of financial issues and instability. And so the amount of profit these companies are making is astronomical and is unbelievable. Isn't it disgusting how much money they make? Billions on our dime, billions. It's disgusting and it's not right. But the law is being challenged, of course it is, by both insurance companies and drug companies. And let's take a closer look at the arguments that are being used of why the negotiations are unconstitutional. And we can take a couple examples here, one from Merck, the pharmaceutical company, who is claiming that the negotiating of prices violates the Fifth Amendment taking clause, where it says that nor shall private property be taken for public use without just compensation. And they are considering that their prescriptions, their drug formulas, constitute private property. So that's why they're citing this clause in the Fifth Amendment, that the negotiations are forcing manufacturers of these patented drugs to sell without fair market value. Now, they are also claiming that this is a violation of the First Amendment, which really protects the government from making laws that abridge freedom of speech. So how is that applicable? They're saying that negotiations coerce manufacturers to agree with government pricings, that their freedom of speech is being impeded. Analysts say that they will have a difficult time proving this. Another lawsuit is being brought up by the U.S. Chamber of Commerce, who, like Merck, is citing the violations of the First and Fifth Amendment, but also the addition of a violation of the Eighth Amendment, which says that federal governments can't impose harsh punishments or fines and would be considered cruel and unusual punishment. And they're saying that if they don't comply with the government regulations, they will be fined a hefty fine, which violates the Eighth Amendment. You know, I am all for a free market and capitalism, but I think when it comes to healthcare, keeping people alive, things that are so critical, I think that there needs to be a cap on how much profit they can make. Why do they need to make billions and billions every year to appease their stockholders? It's crazy. Now, all of this sounds really good for our seniors, those who are 65 years and older and on the Medicare program. It doesn't help the rest of us at the moment, but maybe in some future it'll trickle down to us. But at least it's a start. For the rest of us who are not 65 and not on Medicare, I have made a video on medical tourism in India. I'm going to put a link here on this video, and I think you should check it out. During my visit there, I picked up my medications for a greatly reduced price. Actually, what cost me 1 month of medication here, I got for an entire year in India. So please check that out. There's a lot to be said about medical tourism, but at least America is finally doing something to help our seniors. One final thought, and I know it's going to be a little controversial, but if you are one of the 57 million Americans who in 2026 will be receiving a reduced drug costs and a reduced out-of-pocket amount, you really need to thank your Democrat House of Representative or Democrat Senator. No Republican, zero, voted for this. If you're Republican, you need to take a real serious look at who they're trying to protect. You, the American citizen, or big corporations. Thanks for watching.